Hello viewers, welcome again to the episodes of Clinics with Dr. Vyas. My name is Benta Terry.
Hello everyone, my name is Dr. Vyas. I'm a senior consultant physician and specialist in cardiology and diabetology.
It's interesting because every day we've been talking to our doctor, and the introduction has been he's our senior consultant physician and cardiodiabetologist. But today we will get to know him better. Welcome, Doc.
Thank you.
To this episode.
Yeah.
For the first now official time, you can tell us who you are. That means where you were born, where you schooled, and where you grew up.
Yeah, my full name is Dr. Vyas Marla. Marla is my surname. Yes. Okay. I was born in a town in south of India. My name Kodar. My father was a lawyer. I got educated at my hometown till 10th standard. After that, plus 1, plus 2, that is 11th and 12th standards, I studied in a place by name Nellore. After that, I have done my MBBS from Manipal University, from Kasturba Medical College, which is a constituent college of Manipal University in Mangalore, that is also in south of India. I have done my MD in internal medicine from Dr. NTR Health University in Vijayawada, again in South India. Then I have done my fellowships in cardiology and diabetology, and I have been working since 2014.
Wow, interesting. And when did you come to Kenya?
I came to Kenya in 2018. Okay. I first started with the Eldoret Hospital in Eldoret. I was the chief physician over there. I worked there for 2 years. Then I moved to Medifort Hospital, Kisii. I was the chief physician and also acting medical director in Medifort Hospital for 3 years. In 2022 November, I moved to Nairobi to Meditest Hospital, and from 2024 July, I started my private practice.
Okay. You are Kenyan. You stayed longer.
Yeah, I'm almost a Kenyan.
Yeah, you're almost a Kenyan actually. Any Swahili words you know?
Very little.
The ones that at least you can't get lost in Nairobi.
I at least understand to some point, to some extent, Swahili, but I can't reply back.
Because I know you have Swahili patients.
Yeah.
Okay.
But, yeah.
Doc, now an interesting question. Growing up, did you want to be a doctor?
No, I never actually thought of becoming a doctor when I was a kid.
Yes.
At least up to 10th standard. In 10th standard, when I was finishing, my grandfather asked me to become a doctor. I said, okay, let me give a try, because I was a good student, securing almost first division most of the time. I said, let me try it, and fortunately I got into medicine.
Awesome. And if your granddad could not have asked, what do you think you could have been?
I could have been an engineer or a theoretical physicist.
Engineer, is engineer medicine a path away.
I was good at physics and maths. One of the reasons why I was able to crack the pre-medical entrance test is because of my prowess with the physics and chemistry.
Yeah. Okay. Doc, don't you think a question? Now, if you are not you are not good, let's say, leave alone being good. Other than being good, you didn't feel now that I had not thought of being a doctor, grandpa, no, didn't you argue with him or anything, or you just agreed? What interested you to agree? What pushed you?
The intellectualness that you require to become a doctor, that's what interested me.
Awesome.
You should be proficient at many things to become a doctor.
Sure.
Initially, it was a struggle for me, especially because I was good at maths and physics. Biology was a little difficult for me to grasp, but later part of my life, it became evident to me that I could have done nothing better other than being a physician. Especially.
That is good to know. And how was your childhood like?
My childhood, it's a regular childhood like any other child, except that I was very good at studies and I used to read books, a lot of books actually.
That is
even by 4th standard, I started learning about liquid propulsion systems in rockets.
Because now that brings a word in Kenya, we call them bookworms. I don't know if that applies there.
I was a bookworm. I was known as a bookworm.
Okay. Now bookworms, Doc, do not have a life out of bookworms. Do you have a hobby?
Yeah, a lot of hobbies actually.
What do you enjoy most doing away from treating patients?
I like playing badminton.
Awesome.
Which is, even now I play badminton. At least thrice in a week I play badminton. Apart from that, I like making airplanes which fly. Wow.
So you didn't stop your engineering parts back at 10th grade.
Even now.
Now working in Kenya, it's interesting that most of the time when we are in school, campuses, when you are studying medicine, you studied a lot of, let's say, diseases or infections. Have you like gotten to see all of them practically, or there is a few you've not found here in the country?
See, there are very few diseases which I have not seen in this country. Okay, even today I have seen a congenital heart disease which is very, very rare actually. So, if you put your mind into it, you do diagnose most of the things. And what happens with me is that I am very good at diagnosing those diseases in which diagnosis is elusive.
Okay.
Yeah, so that's how I am able to see most of the diseases.
And the most interesting part of you as a physician in the country?
Most interesting thing is that there's not a single patient in whom I was unable to control the sugar.
That is impressive.
100% of the time we control sugars.
Awesome.
There's not a single patient in whom we didn't control sugars.
And Doc, the most challenging. Now I couldn't say language because at least you mentioned you know a little bit Swahili. So the most challenging
is lack of access to technology because Kenya is a resource poor country. And one more thing is that most of the time I know what needs to be done, but to get the things done, there are financial constraints because this country is very much expensive when compared to India because of the lack of manufacturing.
Don't you think that is where maybe most of our patients prefer when it's something that requires most of the money, resources, either equipment-wise or anything that we don't have access in the country? That is where they are flown to India. I think that can also...
That is actually decreasing a lot.
Nowadays.
As the day compared to the time I started my practice in Kenya and now, the emigration to other countries for treatment is decreasing a lot because most of the diseases we are treating here.
Awesome.
Okay, even the prices are comparable, but still prices can be brought down. Like for medical tourism, what they pay in India, for the same charges they are getting many of the things, not everything, but many of the things which are previously not available. But then again, medical tourism prices in India are high. See, when compared to native Indians, expat prices are almost 2 to 3 times more in India. So if you are paying the same price in the same country, it means it is very expensive.
Sure.
So the prices can be brought down by certain government interventions, but that is not my cup of tea.
Yeah, true. Doc, you mentioned you will be on board for Bodycraft. So what are Bodycraft patients expecting? What should they expect from you?
The best care that I can deliver.
Yes. And we know you as one of the best doctors in line with diabetes. So that is also good to know that they will get that. Now, Doc, one more thing. What is the most thing people assume about you?
People can think that I'm a little costly in the sense my treatment and my these things are, it happens many times. That's one of the reasons is that I do every test that is necessary, but I don't do even a single test that is unnecessary. The reason for doing every test that is necessary is to get the complete diagnosis. And my first encounters are usually costly because of this, because I do a complete evaluation from head to toe. Once I have the full diagnosis, treatment part is easy. That patients have to understand.
Okay, so it's not like you are money oriented, you are patient oriented.
It's not like that. Many a times actually, I cut down prices or I give discount. I argue with the hospital authorities where I am treating the patients. I manage.
Okay.
No matter who is the patient, how rich or poor the patient is, at the end of the day, I do whatever I can to the patient. Either financially or treatment-wise. Treatment-wise, yes, 100% I'll try.
Okay.
But if the patient cannot afford, I will make sure that at least what is there in my hands is delivered to the patient.
Okay, that's good to know. At least that is one of the most positive things your patients or Bodycraft's patients or whatever clinics you visit, that is a good thing for them to know. Now, lastly, a case that you've seen, a case that has been brought to you on the late stage. I don't know if it's okay for you not to mention the patient's name, but at least the case, the name of the infection or something. And then it's a common infection, but mismanaged outside, or people do not get to know it early. But when they are brought to you, you're like, if this was brought to me early, I could have known this because you're good in the diagnosis,
Yeah.
as you said, like something in that line.
It happened very recently, actually.
Mhm.
Patient is a case of HIV. He is in acquired immunodeficiency syndrome. He has developed full-blown lymphomas. Thing is that his sister happens to be a patient of mine. She brought him to me. It's a lymphoma basically, which happens in HIV/AIDS patients. Had this patient been brought to me earlier, I could have saved this patient.
Yeah.
Actually, I lost him very recently,
Sorry?
not many days back. Actually, I felt really bad because lymphomas are treatable. Okay,
Yeah.
but diagnosis early is important.
Yeah, sure. So patients should not ignore any slightest thing,
Yeah.
and they should get to see a
Getting a proper diagnosis.
Diagnosis.
That is what the most important thing. Once you get the diagnosis, treatment is always easy. No matter how complex the disease is.
Yeah. And we are glad that you are into that and you're into treating patients and getting proper diagnosis for proper treatment.
Yeah.
Thank you, Doc.
Yeah.
And we're also proud that you will be on board.
Okay.
Thank you so much.
Thanks a lot.